Assalamualaikum warahmatullahi wabarakatuh. I'm Surya Budi Waluyo, N19EP3007. I will explain about the one of the imaging method, which is MRI or magnetic resonance. So MRI is a medical imaging technique that uses magnetic field and computer-generated radio waves to make a detailed image of the organ and tissues in our body. And the machine of MRI has a large and tube-shaped magnets. When the patient lie inside the MRI, the magnetic field will realign the water molecule in the body so that the radio wave can cause this aligned atom to produce faint signal, which are used to create cross-sectional MRI images, like the slice below. Purpose of the MRI itself is to translate hydrogen distribution in body tissue to the computer generated of atomic structure, and then it was for identify the disease of the central nervous system, and also on the brain, spine, and musculoskeletal disorder. It also used to diagnose of cancer and how severe the cancer is in the patient's body. And then it can also be used to determine the extensive damage to a person after having a traumatic injury. And then it can be used for diagnose or to find the correct course of action for the treatment of the patient. So the history of MRI was started on 1837 when Isidore Rabi developed the method to measure the movement of atomic nuclei, which is called nuclear MRI. Then on 1971, Raymond Damadian used for the medical diagnosis, and also cancer tumor is emitted a different signal and can be detected by the scanner. Then on 1973, the Paul Lauterbur showed NMR produce image with variety of strength and magnetic field to build a picture. Then Peter Mansfield developed the practical process to turn MRI into the rapid imaging technique. And then next is when 1977, the Damadian built the first whole MRI scanner, which is called Indomitable, which is we still use this concept until now. So there are several considerations before the hospital or any medical center to use or to buy the MRI. The first one is the magnetic field, because MRI is producing highly homogeneous magnetic field. And then for the design itself, it is open design, which is may help claustrophobic patients for the technology for this day. And then for the cost itself, we'll have to consider about the building structure, the RF and fringe field shielding, and also the storage and cooling system equipment, and there are any other. For the gradient system of MRI itself, it have faster gradient and higher resolution of image, but it have small field of view for the organ. And MRI is work with the computer, so we have to make sure that the computer is able to work in the magnetic environment to make sure it was able to run the scanning process. Then the principle of the operation of the MRI itself. So our body, there are a lot of hydrogen, including hydrogen nuclei, or also called as proton. And in this proton, we can, when it was on the strong magnetic field, it will line up toward whether parallel or anti-parallel. When it was anti-parallel, it needs a higher energy so that most of proton line in a parallel direction. And the position of the proton were not exactly the same because it is also spins the wobble. And the frequency of the magnetic moments can be measured using the Larmor equation. F is equal to gamma times B, capital B. F stands for the frequency in the unit of millihertz. And then the gamma is for the gyromagnetic ratio or a megahertz over Tesla. And then the B is stand for the magnetic field strength, which have the unit Tesla. And the Larmor frequency itself can be measured by omega is equal to y times b. So there are 4 steps of the principle of operation. First step is when all of the protons become aligned with net magnetization or BO. Then the RF excitation pulse is applied to align protons. And the aligned proton will become excited by the RF pulse and it will flips into the transfer plane. And the RF pulse will end and the nets of magnetization will begin to relax and return into the longitudinal plane. So there are several advantages of the MRI. The first one is the quality of the photos because MRI can give the very clear and detailed image. It also can create hundreds of images from different direction and different orientation because its ability to cover most of part of our body. Then MRI is having less allergic reaction through the patient's body because it's not involved any radiation and the contrasting agent is pretty safe, even though the allergic reaction may happen when the iodine-based material were used for the X-ray or the CT scan. And the last advantages is MRI can detect cancer. They are able to trace about how severe the cancer has spread and also how far it is on the patient's body. And it can help the doctor or the physician to decide for the best treatment method that they can give to the patient. Even though MRI have a lot of advantages, but there are also some limitation when using this MRI. The first one is the time consuming. Even though it is able to take many picture from different angle, but it still take time to proceed those images into the computer model to be seen by the physician to be examined. And then for the bone injury, there are the MRI is minor toward the CT scan for detecting the bone injury. And the MRI model right now is also have a narrow model. So for the patient that having claustrophobia or phobia towards the small space, they might feel uncomfortable with this. And the last one is the hemorrhage. MRI is minor toward the CT scan, so for detecting the acute hemorrhage. It have some ability to detect the the light stage of the hemorrhage. So there are some summary of the MRI. MRI is an imaging procedure which uses the magnetic field and radio waves to take picture inside of our body. Then MRI is used to determine a condition that affect the soft tissues like tumor, stroke, and brain injury. Then the third one is the price is pretty expensive and it can be found in health center in advanced area only. So it was not that easy to find this facility. especially on the rural area. An MRI can produce high quality image than other modalities. This is my references. Then also I have some video to show.
MRI is a medical imaging device commonly used to examine the soft tissues of the human body. Let's meet the machine. The key components are the magnet, radio waves, gradient, and a computer. Our bodies are made up of 60% water, and water is magnetic. Each of the billions of water molecules inside us consists of an oxygen atom bonded to two hydrogen atoms. We know it as H2O. Small parts of the hydrogen atoms act as tiny magnets and are very sensitive to magnetic fields. MRI stands for magnetic resonance imaging, and an MRI scanner is one of the main diagnostic tools that doctors use to examine inside our bodies. The first step in taking an MRI scan is to use a big magnet to produce a unified magnetic field around the patient. The gradient adjusts the magnetic field into smaller sections of different magnetic strengths to isolate specific body parts, for example, the brain. Normally, the water molecules inside us are arranged randomly, but when we lie inside the magnetic field, most of our water molecules move at the same rhythm or frequency as the magnetic field. The ones that don't move along the magnetic field are called low-energy water molecules. To create an image of a body part, for example the brain, the machine focuses on the low-energy water molecules. Radio waves move at the same rhythm or frequency as the magnetic fields in an MRI machine. By sending radio waves that match or resonate with the magnetic field, the low-energy water molecules absorb the energy they need to move alongside the magnetic field. When the machine stops emitting radio waves, the water molecules that had just moved along the magnetic field release the energy they had absorbed and go back to their position. This movement is detected by the MRI machine, and the signal is sent to a powerful computer, which uses imaging software to translate the information into an image of the body. By taking images of the body in each section of the magnetic field, the machine produces a final three-dimensional image of the organ, which doctors can analyze to make a diagnosis.
So that was my explanation for the MRI, and I hope it's helped. And that's all from me. Thank you.